Wait for the sign. I have a sign. Right, good afternoon everyone and welcome to this public meeting of the House of Keys Select Committee on Tobacco and Nicotine Products. I'm Dr Michelle Hayward, MHK, and I chair this committee, and with me are Joni Farragher, MHK, and Stu Peters, MHK. Before we begin, can I ask you to please make sure that your mobile phone is turned off or on silent and your laptop is also on silent. Pause for dramatic effect.
Good reminder, thank you.
You're welcome. Right, welcome. For the benefit of Hansards and anyone listening, please could you introduce yourself, giving your job title and how long you've been in your current role?
Hello, my name is Dr Matthew Tyrer. I'm Director of Public Health and Chief Medical Officer, and I've been in role for the last 4 months.
Good afternoon, my name is Karl Cubbon. I'm a Policy Officer and the Public Health Director of Cabinet Office, and I've been in this current position coming up to just over 3.25 years, and in government as a whole for over 25.
Thank you. Just to start with some introductory questions, this committee was set up as a consequence of a private member's bill that I suggested to the House of Keys, and they've asked us to go away and find some more evidence about things. So we've got questions ranging across the whole range of dealing with smoking and vaping and nicotine. Can we talk about the current levels of smoking on the Isle of Man and what the latest data is and what's that looking like?
Certainly. So, at a high level, our smoking rate is lower than our nearest comparator, which we would use England in terms of its data. So, the rate of smoking in England is 11.6% of the population, and that was from 2023. On the Isle of Man for 2022, which is the most recent survey data that we have, our smoking rate was 10.8%. We are measuring that from a comparatively small population, so that means that the true value of that could be a bit higher, could be a bit lower, but essentially that value that it could be between includes where England sits. So we're not significantly different. So we are comparable from that perspective. We also see a slightly lower rate of women smoking during pregnancy than would be seen across as well.
Okay. Is there, in that data, a dominant demographic of smokers? Have we still got the resistant smokers who've been doing it for years or giving up, or are we starting to see changes in the demographic compared to England?
I mean, generally speaking, we're seeing similar trends. So younger people are less likely to take up smoking than probably they ever have been before. So we are tending to see that uptake of smoking is continuing to decrease in that age group. So it is typically older people, and by older in this instance, I mean compared to younger people. I realise what I've just done.
So very scientific.
I do mean, so people are more likely to be smoking if they're 30 plus than if they're in their late teens or 20s.
Yeah.
So it's people who have taken up smoking 10 years ago or more tends to be where we're seeing the bulk of people.
Okay. If we switch our attention to vaping then, what are the current levels of vaping in the Isle of Man and how does that compare?
So we haven't got a recorded statistic at the moment on the current vaping rates, because smoking is where we tend to focus our attention because of its damaging health impacts. So that will form the subject of future analysis, but essentially the vaping rates are higher in younger people than they are in older people, but what we are seeing as a trend is people who are stopping smoking using vaping as a mechanism to reduce their smoking or to quit entirely. So in line with the Chief Medical Officers of England, Wales, Scotland and Northern Ireland, I would echo and align with a similar kind of principle that if people are currently smoking, actually we want them to step down to a vape. However, what we don't want to see is people starting vaping or smoking if they've never done either.
Okay, so young people and vaping seems to be, we've obviously had the vaping and young persons bill
yes.
here, recognising, the Keys recognised that it was a problem to bring that legislation through. What do you think are the drivers for young people taking up vaping?
So that's a very interesting question, and there are a range of potential factors which lead to people starting vaping. Some of that is people who were smoking switching to a vape, which is a positive step, obviously. The second is normalisation of vapes rather than cigarettes amongst groups of young people or groups of people in communities where vaping is more normal now than smoking would be. Another would be around the way that vapes were marketed. Now, I understand that the legislative picture has changed here, so it's ahead in terms of the way that vapes are marketed compared to England. But what we were seeing when I was in my previous role as Director of Public Health across, we would see that it was the positioning of vapes and the marketing of vapes to push them in using bright colours, flavours like bubblegum and popcorn and so forth, to make them appealing to young people. So there is a degree of aggressive marketing of vapes as a nicotine-containing product towards children and young people.
The equivalent of Alka-Pops, but in vaping terms.
I think that would be a good analogy, yes.
Okay. Stu?
We understand that Public Health promote the Quit For You Stop Smoking service on the Isle of Man to help people quit smoking. What does the support actually entail, and is there a large take-up of the service?
So whilst I quickly find my statistics, because I have the rates here in front of me, the key element in terms of supporting people to quit smoking is that we have a smoking cessation advisor, and she supports individuals who reach out to the service or are referred into the service to identify ways that they can reduce their smoking, whether that's through swapping to a vape in order to stop smoking, or other nicotine replacement therapies that they may find more amenable to their quit journey. So she works with them one-on-one, and essentially the goal there is to find something that is personally suited to that individual to help them to quit, and also to support them if they relapse and need to be supported to quit again. It's been expanded as well because we recognise the importance of supporting women who are pregnant to quit smoking. It's a really positive opportunity for people to make that lifestyle change. So we've recently started the Quit For Two programme as part of that. In terms of the performance of the Quit For You programme, between April 23 and March 24, 271 clients set a quit date with the service. 194 of those successfully quit, so that's a 72% success rate. And compared to other smoking cessation services, again using UK data, they typically see a 54% success rate, so that's quite a lot higher. To date, this financial year, 295 clients have been supported. 22 of those were pregnant women, but 249 of those have set a quit date, and 169 so far have successfully quit. So we're on track to have the best performance year for that service.
Okay, and so is it now policy to use vapes as a way of getting people off cigarettes? Because years and years ago, I remember asking the Quit For You person in an interview whether or not vapes might be a good alternative. And at that time, it was like, well, we don't know enough about them, actually.
So vapes are a tool that can be used to support people to quit smoking. And I think that's the best context to think about vapes in. That's where we would like them to be used most effectively. That is not to be saying that they are used in isolation. There are other nicotine replacement options that can be explored with individuals as well. So vaping is another tool in that toolkit of how we support people to quit.
And how effective is it compared to the other tools like the nicotine gum and the patches and all the rest of it?
That comes down to the individual. So different people will find different things greater or less effective in terms of supporting them on their quit journey. I think the key element here is that we don't really break it down by the modality that people use. We are focused on empowering people to stop smoking. So our performance data is at the moment broken down by people that set a quit date and then went on to successfully quit by that date.
Yeah, okay. Do many young people use the service, or is it more the legacy smoker?
So we support a range of individuals. In terms of an age breakdown, that would be something that we could try to provide in writing afterwards, but whether the numbers on some of those blocks would be sufficiently small that it might make individuals identifiable, we might have to tell you that it's a very small number
So
without
less
saying
than
the exact
5
number.
category will do.
Yes, exactly. So we'll provide that afterwards.
All right, so 290 people, I think, was the current figure.
295 have been supported,
Yeah.
and 249 of those have set a quit date.
Is the, and I realise this is probably a leading question, is the service properly funded to be
Yeah.
able to do what you want to do with it?
Yes, so we have budget within the public health department to support that. We are looking at how we currently deliver the service to make sure that it is up to date and fit for purpose. We are looking at how it does outreach, but also with the fact that whilst it's delivering very well on the smoking cessation front, we are recognising that the numbers of people who are smoking continues to come down. So it's how we make that service supportive of lifestyle more generally as it goes forward. So we are making sure that the service is not only operating well now with the resources that it needs, but also that we make it fit for the future to continue delivering smoking cessation potentially alongside other lifestyle offers.
And is it sufficiently resourced? I mean, would you improve the figures if you had more centres around the island, sort of thing?
So in terms of its current operating model, we are in a position where we will be looking to recruit to some vacancies that we do have within that service, but it is stable, it is delivering, and with additional capacity it will be able to deliver an enhanced offer. But at the moment it's delivering 6 clinics across the island, including that Quit for 2 pregnancy one, and with the potential for additional support over the telephone and in group settings if people would prefer that as an option.
It sounds like good news that actually demand is probably reducing rather than increasing.
So I suspect that there's two slightly at odds things there, because we've seen more people come to the service, but that's on a background of more people therefore wanting to quit and successfully quitting. So we've had just over 20 more clients come to us this year compared to last year looking to quit smoking. But overall, that's on a position of the smoking rate overall declining. So more people coming forward to quit is representative of, I would say, a public attitude shifting towards more people making definitive decisions that they, A, want to quit, and B, are seeking the best support to be able to do so successfully.
Just a thought, what is the biggest driver of people wanting to quit? Because I realise that's probably changed over the years.
Again, it's a very complex question to answer because it has a whole range of things that drive it. We know that the increase in cost is a driver. We know that bans in public places have been a significant drive. We know that changing the regulations on advertising, the way that cigarette packets are designed, that has had a significant effect. So everything has kind of developed a cumulative push to make people that are currently smoking want to quit, and not just want to quit, because actually the evidence suggests from survey data that was that made part of the Khan review, Make Smoking Obsolete, that was published in 2022, the majority of smokers want to quit. It's the difference though between wanting to quit and making a decision to take an action to quit, and I think that's what shifted. The other thing that has gone alongside all of the kind of legislative and kind of design around advertising and packet design and those sorts of things is the fact that societal norms have shifted significantly. Smoking is not seen as something which is as acceptable as it was. The days of walls and roofs being nicotine stained and people being exposed to large amounts of secondhand smoke in indoor settings are a long way behind us, and as a result public opinion has shifted significantly, both in terms of the way that people perceive smoking itself or wanting to quit smoking, but also people who don't smoke and their perception around and feelings around being exposed to somebody else's smoke.
Thank you. Jodie?
Could I just check one thing on that? Did you say that there was one smoking cessation advisor for the Quit for You and the Quit for 2 programmes?
At the current time, So they are the manager for that service, and there are 2 vacancies that have been approved to recruit to. So that we will be exploring that as soon as we have gone through the processes that we need to do in order to do that, to make sure that the service is supported. We are supported in terms of how the service is delivered at the moment by some staff from the bank. So there is one permanent member of staff who is currently supported by bank until we've completed that recruitment process.
Thank you.
Sorry, that was me remembering my team structure and neglecting to include a bank person, and I do apologise to them and the committee.
Thank you very much. So I want to ask a few questions now about support available locally to stop vaping. So could we start, could you give an outline of the emerging data around vaping harms?
So it takes a very long time to generate the kinds of population level evidence that led to the recognition of the level of harm that smoking led to, or leads to, indeed. At the moment, the consensus of the evidence is that vaping is overall less harmful than use of tobacco specifically. That's part of the reason that the recommendation is that it is a good quit mechanism to support somebody who's currently smoking to stop smoking. And that's part of the reason that we also recommend that if you don't smoke or vape, it's best not to start. Because at the end of the day, you are inhaling something that and taking it into your body, and the lungs are a good way to exchange things between the air and your body. That's part of the reason that tobacco gets in. It's part of the reason that we give some medications in an inhaled format. It gets it into the blood quite quickly, but the evidence is at the moment giving a strong indication that it is significantly less harmful than smoking, and I think that's the most important thing here. If you are currently smoking, switching to a vape will be less harmful. And smoking is still the most harmful behaviour choice that somebody can make for their health.
Absolutely, but obviously we know that a lot of young people are just taking up immediately vaping. So is there any specialist support available locally to quit vaping? So
currently, where somebody is using it as a quit aid, they are supported through that process. Currently, if somebody is wanting just to quit vaping, that we are able to offer advice and guidance, but there isn't a specific service that is supporting somebody to quit vaping alone, in terms of what we offer.
Do you think this could be something that might be developed in the future? Could there be more support available to help people quit vaping?
So obviously this is a developing area. It's an area where guidance and support around how to support people around that is still a bit thin on the ground compared to the very strong evidence-based approaches to smoking cessation. So as that continues to develop, we will stay abreast of the evidence, and where we have a clearer indication of mechanisms and alternatives to support people to quit, that may be an area that we expand into, it's not seeing the quantities of inquiries by comparison to people wanting to quit smoking.
Okay, so at the moment we're not really sure what support might look like to help people stop vaping.
I think that's a fair summation of the evidence picture more generally around smoking cessation. Really robust around tobacco. It is still a developing area around vaping.
Okay. And do you think that if we did have an influx of queries about how to stop vaping, we would have sufficient resource to be able to deal with that?
So that is part of how we are looking at making the Quit For You programme as sustainable as possible, is looking at what other lifestyle modifications would be appropriate to include and upskill the team as part of that service, because we know that if we are successful in continuing to reduce the numbers of people who are smoking, that capacity will increase.
Thank you.
Thank you. Just to focus really in on young people with smoking and vaping, because that was where particular concerns were expressed. So we've got almost a paradoxical situation where smoking is declining, but then vaping is taking off, and we know from evidence from high schools that we've had particular problems with that. It's what led to the vaping bill in the first place. Mm-hmm. Exploring the reasons around that, what's your understanding of the research about the impact of nicotine on developing brains in children and young adults?
ultimately, nicotine is an addictive and easily absorbed chemical. It is something that there isn't... In terms of what we know around, particularly on the tobacco side of things, just to kind of come in through that route, if that's okay, we know that tobacco products that introduce people to nicotine, whatever modality that tobacco is introduced to people via, whether that's smoking or some of the other the other tobacco-based products, we know that there isn't a safe level of tobacco usage. Nicotine, as a specific isolated part of that, has a bit more nuance around it than the tobacco products themselves, but we know it's highly addictive, and I think that by itself is a reason to be avoiding exposure for children and young people to it, because it of course locks you then in financially or physically, emotionally, into being reliant on further use of nicotine.
So is it a fair summation to say that when tobacco companies have shifted their attention away from tobacco and started moving into vape products, particularly with the popcorn flavours and bubblegum flavours, that's almost a cynical move to get your next generation of nicotine addicts?
I wouldn't say that I find it easy to necessarily enter into the mindset of the tobacco companies. However, I think it's not unreasonable. Again, I think there's a really two striking quotes from the Khan review that I think are really pertinent to this, and one of which is around the fact that when used as recommended, cigarettes and other products that are produced by the tobacco industry, when they're used as intended, they're one of the only products that we would market. Well, as far as I'm aware, they're the only legal consumer product that will kill most of its users. And I think the second part that goes with it is, if it were a new product choosing to be marketed at this stage, in the absence of tobacco having been a prevalent product for a long time, there is no way that we would allow it onto our supermarket shelves, because it will lead to, if people don't quit, half to 2/3 of smokers dying from smoking related diseases, which it's a very striking number. And I think that where you have there is a set of things that are being talked about in a lot of public health circles at the moment called the commercial determinants of health, which is very much around the fact that industry is an extremely important player, whatever that industry is, in all of our health. And some particular industries, from a commercial perspective, are based on harm predominantly, and the tobacco industry is the perfect encapsulation of that. Its business model is predicated on producing a product that will harm its users, and is therefore reliant on continuing to foster addiction to nicotine in order to continue to support its production line. So whether or not it is a cynical attempt, I leave you to make that decision yourself.
It's a business decision then.
Indeed.
Stu, do you want to?
I mean, I gave up smoking cigarettes by vaping. I tried every other method to give up, none of it worked for me, but vaping did, back in 2010. And at the time, one of the things that convinced me was an article that I read that suggested that nicotine in and of itself is not dangerous. It's highly addictive, but it's not particularly dangerous, because if you overdose on it, it makes you sick and you stop and all the rest of it. Is that still the case? I'm not a scientist, and you are, so I wonder whether or not it's still fair to say that nicotine in itself is not a health danger.
I mean, my perspective with my background as a clinician, if you don't need to take a medication or a product into your body, there is no reason to do so.
Well, that's true of coffee and beer as well, isn't it?
It is, but of course, nicotine specifically, being an addictive substance and being a substance with a high degree of complexity around it, if there isn't a need to take nicotine, then I would not recommend doing so. On the other hand, again, the vapes as a method of supporting somebody to quit something which is far more harmful is it remains a very pragmatic quit tool.
Lesser of two evils.
Indeed. So that, again, that's part of the reason that we come back repeatedly to the advice of, if you smoke, switch to a vape. If you're not smoking or vaping, don't start either. Because at the end of the day, you are exposing yourself to a product that is designed to be addictive and doesn't really confer any benefits. So consequently, my main advice would be to not use nicotine if you do not need to use nicotine. I think going any further in terms of the health benefits or disbenefits of taking any of particular nicotine replacement products is almost it almost gets in the way of the main thing, which is actually we don't want people to be using nicotine if there isn't a reason to be using nicotine, and I can't think of one off the top of my head.
Thank you. When I introduced the private members bill, there were 3 sections in what I was proposing. One of those, and I think we've probably already touched on this, was to update the definitions of tobacco products that are currently prescribed, because we have some gaps in that. So we don't cover water pipe tobacco or nasal tobacco. If you can smoke it or sniff it, it's covered. But there are new delivery methods, and including the snooze, the little packs and stuff like that. From your earlier evidence where you said just tobacco in all its forms should be pretty much avoided, would you consider that extending those definitions for our current legislation was probably a sensible move to encapsulate those other forms of tobacco in whatever, and put some catch-all, any tobacco products, kind of into the legislation to future-proof it against developments for delivery methods for tobacco?
So there's 2 parts to that, and the first of which is to emphasise that the World Health Organization are very emphatic that all forms of tobacco are harmful and that there isn't a safe level of exposure to it. So I think that's the bit that kind of sets it up. I'm joined today by Karl, specifically because of his long experience with the policy and legislation side of things. So in terms of some of the specific questions around the what should and shouldn't be included in the bill, I think it would be pertinent just to touch on what has been included or not included at this stage within the Smoking and Vaping Act that's going through the Parliament across at the moment, purely because actually regulatory alignment gives us quite a lot of benefit. So if there are key elements that we can pick out of that, I think it would be positive. And once we've gone through that, I'll pick the question back up if that's okay.
That's fine. Karl?
I would hesitate. I haven't looked into it sufficient depth to give a definitive answer, but certainly I'd agree with you that from the work I've done when I was developing the Vaping Products Act and looking at the provisions around that, there certainly seems to be a lack of consistency in the definition of what is tobacco for the purposes of various acts of Tynwald. So the tobacco, I'll bang on the name, but effectively the Tobacco Products Duty Act, or whatever it is titled.
1986 one, yeah.
Thank you. Has a definition. The Children and Young Persons Act 1966 has a definition, and then you look at the Public Health Tobacco Act, and that has a provision for a definition as well, and they all don't quite align. I think there's opportunities, as you said, for people who are looking to introduce new forms to try and take advantages of those potential regulatory loopholes. So if there was the opportunity to look at it and look into it in more detail and produce a definition which works for all those various pieces of legislation and avoids the question of regulatory loopholes, I think that would be a good opportunity to take.
Thank you. So then the second part of what I'd suggested originally was controls around nicotine products, and kind of heading along the same lines. So you've told us today that nicotine is highly addictive, and the advice would be if you don't smoke or vape, then don't start, because you won't end up with that addiction. But we have, at the moment, we've controlled vapes and the nicotine that's in there. There are obviously some products that are sold via pharmacies, and so there is a level of control over those. But there are also now nicotine pouches that are emerging, and you can buy them at the garage. There's no age restriction. We have no control over that. So it probably sits across you both again, I'm afraid. But would you consider that it was sensible to control access to those products in an age restricted way? So the ones that we really have no control over at the moment.
I can speak with an answer from a technical perspective and note that controls on nicotine products are being considered as part of the UK bill, and that certainly if the UK was to introduce those controls successfully, then it would be reasonable for us to look at introducing similar measures on the island just for the purposes of maintaining regulatory alignment. In terms of the health impacts or detriments of nicotine products in general, I obviously can't speak of. I will turn to Matt for that one.
So it's a complex and developing area, I think, is one of the key elements here. That with the declining civil acceptability of cigarette smoking, as discussed with vapes as potentially another way for tobacco to enter the market, other nicotine-containing products will be arising potentially from a similar drive to diversify the way of maintaining that business model. In terms of a decision around its inclusion, I think ultimately that obviously will need to be a political decision. However, again, from the perspective of these are products which are not necessarily giving you any health benefit and may have a health disbenefit, it's without going into detail on some of the novel things which will have other ingredients that I can't comment on without seeing a full ingredients list and having somebody probably with a much greater degree of knowledge on specific elements of chemistry and pharmacology to go through those ingredients lists and say, well, that one is one we should remove and that one isn't. I would go back to the same position that I've taken, that ultimately nicotine is an addictive chemical. We don't really want people becoming addicted to it. It is not good for people financially at the very least, let alone their health benefits or disbenefits, and therefore I would not be advocating for people to use these products. And I certainly wouldn't be suggesting that children or young people should be in a position where they are getting stuck in a cycle of addiction to nicotine.
Thank you. This might be a question you don't have an answer to yet because of the lack of data, but has the vaping bill had any noticeable effect on the behaviour or the rates of young people vaping? Because you wouldn't have been here for the political kind of outcry that drove the policy coming through and pushed the bill through.
We can look into where any data collection on that is currently at. We certainly don't have it with us today, so we'll need to come back to you in writing on what is and isn't feasible in terms of assessing that at the moment. Whether the impact of it will be seen yet or whether it's a bit too early to tell as well, it will be part of that response.
Okay. If we think about young people then, is there any targeted public health messaging that you're aware of or that you're running at the moment that's aimed specifically at young people regarding nicotine addiction, either via smoking or vaping or anti-smoking, and what channels would be suitable for that demographic?
That is a very good question. Again, the traditional communications channels that we use don't always resound or land brilliantly well with children and young people. The methods by which people reach out to them are changing almost on a month-by-month basis, if not a day-by-day basis. Certainly, there is as an age group, in terms of the smoking side of things, it's still where we're seeing the lowest rate of people starting smoking. So I think the messages have generally penetrated through well with that age group. I think it's more difficult around the vaping side of things. Since I started here, there hasn't been a specific comms campaign around it. However, we are reviewing our comms campaigns at the moment, and we know that there are things that we will tap into around smoking cessation. So, for example, Stoptober is something that we will continue to support in terms of pushing the message out around smoking cessation and vaping. That's people being encouraged to quit in the month of October. So there are a range of different high-profile campaigns. In terms of how we make use of some of the more specific routes and channels of communicating with young people, I would need to defer to some people with more experience of some of the new communications modalities, because I will fully admit that I am slightly behind myself now.
And I'm going to apologise for having asked what was an instantly ageing question for everyone in the room today, to realise that we've no idea what these young channels are.
And myself included, I'm not up to date on things that my peers are up to date on when it comes to some elements of social media, because largely time, unfortunately.
Thank you. The UK are obviously proceeding with a bill to introduce a generational ban on tobacco as part of their strategy to head towards smoke-free by 2030. The Isle of Man also declared that it was going to become smoke-free by 2030. So what plans are in place to achieve this goal in the next 5 years? And would you consider legislating in a similar way to the UK?
So, in terms of the plans that are in place, I think that's very much around, at the core of it, is working with people that want to quit. That is first and foremost what we need, where we should be working preventatively, because we prevent future harms being accrued by individuals who are currently smoking. So I think that first and foremost is the cornerstone and keystone of what we're doing. I think that there is a really important element around what the legislative landscape looks like, because we know that the biggest drivers of reducing smoking rates haven't been things that happen on a small scale. They have been things that have happened at a significant national scale in countries around the world. So we know that when decisions have been taken around restricting where you can smoke, around changing the design or restricting the advertising of tobacco products, those are the things which makes the largest degree of population impact. There is a thing that we use to determine what's going to be the most effective whole population intervention, called the Nuffield ladder. And it essentially says, it starts at the bottom at do nothing, and at the top is outright ban. And you kind of work through that in order to get a really harmful behavioural thing either reduced in its prevalence or eliminated. It starts less restrictively and with things which are more socially acceptable, towards things which require a larger bulk of public opinion to be in favour of in order to do. So that would include things like public spaces bans, advertising bans, disincentivisation, or incentivisation to stop. So there are lots of mechanisms that can be done, and we are starting, as the British Isles and Crown dependencies, to be in a position where we are starting to get towards the end of that ladder of interventions, because we have done all of the things that are at the less restrictive end. If we want to make smoking obsolete, and the Khan Review acknowledges that the pace of policy development across resets that goal of 2030 as being 2040 to eliminate it, with being down to around 5% smoking prevalence by 2030. But ultimately, it is the significant things that will make the final difference in being able to get to a point where we have very little or no smoking going on within the population. And ultimately, that is one of the best things that we can do for people's long-term health. So with regard to further legislation, again, the decision on that is a purely political one. I can only advise that that is what has been most effective, and that ultimately smoking cessation is a public good.
If the bill in the UK passes and imposes a generational ban there, and we don't have any similar legislation in the Isle of Man, it's been suggested to us that there might be a risk of tobacco tourism, whereby teenagers and young people might visit the Isle of Man specifically to access products that they couldn't legally do so in the UK. Do you think that's likely? Is there any evidence of that kind of... I'm saying this and I'm thinking, I used to do the booze cruises to France. I'm not sure why I'm asking the question. But yeah, I mean, what do you think about that as a possibility?
Without legislation being in place and seeing what happens, it's a degree of educated guesswork on that, obviously. Generally speaking, if people are wanting to make money off products that are harmful, loopholes get exploited. I think that is true regardless of what particular thing we're talking about regulating. Having a discontinuity in the regulatory landscape between us and the United Kingdom I would defer to the opinions of those in trading standards and the regulatory landscape. But it is reasonable to make an assumption that it would lead to people trying to exploit the loophole that we would be leaving open, with a potential impact then on us becoming somewhere where illicit tobacco use, tobacco smuggling could be something which we would see more of because that loophole exists. But again, I would defer on trying to enumerate that or express what that would mean in terms of enforcement or regulation or inspections to colleagues who are much more informed on the regulatory and enforcement side.
Thank you.
Could I just ask, with reference to the Isle of Man government's stated ambition to be smoke-free by 2030, you referred to a perhaps 5% overall rate and then smoke-free by 2040, which indicates that you might think we're not on track for the 2030 goal.
So the evidence that I'm using for that was the recently published Making Smoking Obsolete report that I'm very familiar with from my time as Director of Public Health in England. That report, when it did an analysis of smoking cessation, a very deep and detailed review of the landscape around smoked tobacco, indicated that without significant, in their context, which I fully accept is not quite the same as our context at all, but essentially 2030 as a goal for them was optimistic without significant additional investment or significant changes to the regulatory landscape. Of course, this was before the announcement of the generational smoking bill, which will have an impact which would be larger than the Khan report aimed for. But he essentially said 2030 is optimistic based on how things were in 2022, and that 2040 was therefore more likely. Obviously, a significant piece of legislation will affect that in a positive way.
Okay, so in terms of the Isle of Man's target of 2030, has public health drawn up any roadmap in order for the Isle of Man to be able to achieve that target, or is there any work going on to work towards that 2030 goal?
There is the range of work that we are undertaking is reducing the smoking rate. Also, societal pressure is reducing the smoking rate. So trying to say which thing is more attributable in terms of the work that we're doing is not straightforward. However, I think that a significant change in the regulatory landscape that reduces young people's access to tobacco is going to have the largest possible impact by comparison to the kinds of activities that we can undertake as a small public health team. Because that is what the evidence says for across the board for all large policy-driven and legislation-driven smoking cessation interventions. That's where we get the biggest outcome in terms of people quitting. We will support them to quit when people make the decision to do so. So encouraging and driving people towards getting the support to help them quit is the landscape where we will generate the largest number of quits. But supporting people to never access tobacco isn't something that we can include within our roadmap because, of course, it sits with government to make policy decision and legislative decision. That was a slightly wordy answer. I do apologise for, because it's a complex landscape with lots of moving parts, all of which come together ultimately to reduce the smoking rate.
Okay, thank you. So would you say that public health is adequately resourced and is doing horizon scanning in this area to take account of the changing landscape, both legislatively and in terms of the demographics of people who smoke and people who vape?
So in terms of assessing the number of people who smoke or vape, one of the things that we carry out on a routine basis alongside surveys that are done by Statistics Isle of Man is that we do health and lifestyle surveys. That's what generates our information about smoking, the numbers of people who are currently smoking and public attitudes towards some of those health implications. So the most up-to-date and routine data about what's happening with people wanting to quit comes from the service. Then we've got the population prevalence, which comes from the survey data, and it's important to put alongside that we are comparable to what the England average is doing. So putting the three things together gives us a clear picture around tobacco in particular. Obviously, as the landscape changes, we will need to enhance how that works around vaping.
Okay, thank you.
Right, I think we've covered anything. Stu, do you have anything else
No.
to ask? No. Is there anything else that we haven't asked about today that you think might be relevant to the work of this committee and to the possible bill that we were looking at?
I think the only thing that I would really want to emphasise is a couple of things that I said over the course of it, which is we wouldn't choose to legalise tobacco if it were a new product being put to market today, knowing what we know about it and the impact it has on people's health. Quitting smoking is the best decision that people can make for their health. Never starting is an even better decision. And we know that the swell of public opinion generally is towards either the current amount of legislation or more, skewed more towards or more restriction on smoking. Therefore, it is a good time to be considering additional mechanisms, legal, legislative, or in terms of services that we offer, to increase the number of people who either never start smoking or continue to quit. So I think those are just the things that I would want to emphasise.
Thank you. And Karl?
There's nothing further from me at this stage, thank you. I might provide some further responses in writing to the committee at a later date.
Okay, that's fine. Thank you very much. In which case, I'd like to thank you both for coming along today, and the committee will now sit in private.